Hi, good morning, everybody. It's so great to see everybody joining in today on a Sunday morning. Hi, welcome, everybody. We'll wait for a minute or so and we'll let our attendees join in, and then we will start with the webinar. Meanwhile, can everybody drop in the chat box where they are from? So starting from me, I am Dhruvi and I am from Mumbai. So let's make this session as interactive as possible. So please drop in your questions, all the answers, all of these things from in the chat box, and we can take it up one by one. All right. So I have Sagar. Hi, Sagar. He's from Pune. Hi, Ajay. You're from Gurgaon. That's great. Hi, Tarun. You're from Delhi. Hi Nirbhai, you're from Hoshiarpur. Hi everyone. Hi, I can see Ashish from Delhi. Wow, we have our attendees joining from Pan India, and there are participants from Pan Asia as well. I see Arun Ghosh from New Delhi, Safia from Hyderabad, Telangana. Great. I see a variety of people who have joined. Welcome, everybody. Welcome. I hope you're doing well, and welcome to the webinar. So we'll be starting the webinar in a minute. We'll let everybody join. Meanwhile, one of a team member will be posting a link to the community, WhatsApp community, where you can join, and you will be able to know about all the recent updates and what we've been up to about our upcoming webinars. Amruteshwari saying, okay, am I audible now? Is this better? Okay. So like I was talking about a WhatsApp community, there's a link, you can join the community, WhatsApp community right away, and you can know about the upcoming updates. All right. So starting with the webinar, welcome everybody. It's a Sunday, sunny morning, and thank you for joining today. Uh, we all know that the entire webinar is on IBS. Can you drop an emoji so that we know you are not sleeping on a Sunday morning? So just drop in an emoji in the comment section. How often or do you experience IBS symptoms? I see. Okay, thank you, Amriteshwari. All right. I see somebody is raising a hand. If you have any doubt, any question, you can drop in the chat box. Okay, I see a variety of symbols. That's great. All right. Okay, so moving ahead, now let's talk about what gut health index is. Okay, now the gut health index or a score is something that Dr. Reddy's have come up with to understand where your gut health lies. Okay, a score below 40 means your gut health needs focus, and anywhere above 40 is also something where your gut health would need a rescue. All right, so you see a QR code, scan the QR code, or you can click on the link that is there in the chat box to take your gut health score and drop down in the chat box to understand what your gut health is and does it need care or does it need special care. So let us know about it. Write down in the chat box and let us know. This link is there on the chat box, so you can simply scan the QR code and take the gut health test for free. All right, we'll wait for a minute. The gut health score or understanding about your gut health is very important. So take the score and let me know what your gut health score says or what your gut is actually saying. There's a link that is mentioned and there's a QR to scan. We also have a special guest joining us. I'll be introducing her a little later. I believe most of you have taken the score. Can we write down one by one on the chat box? Okay, I see Sagar has a score of 40. Your gut health definitely needs an attention. All right. Anybody else who have taken the score? Safia also says 40. Okay. Do not worry, Safia, Sagar. We are here to address this and we'll definitely be helping you out by the end of the webinar. There are a lot of things coming up. Make sure you stay till the end. Tanuja says 30. Tanuja, you need special care. Please share the link for questionnaire is Neha's question. There's a link that will be shared for the gut health index. You can just tap on it and you can fill the questionnaire and let us know. So moving ahead, I see a lot of scores have been taken and a lot of you are taking the score. Keep dropping in the chat box so we know. Moving ahead, how will the entire program benefit you? First, understanding of IBS is important, and that's when you can manage IBS. So there'll be experts in IBS who will be making you understand what IBS is and how you can manage that, how to manage the stress, importance of gut cleanse and trigger food elimination. And in the webinar, there are going to be fun quizzes. So I would want the audience is super interactive. I love that. And I would want you to continue being interactive and keep on posting your answers on the chat box. Now, like I said, there's a special guest today. She's Dr. Soni Agrawal. She's a medical advisor and condition management at Dr. Reddy's laboratory. And myself, I'm Dhruvi Shah. I'm a lead coach nutritionist here. I'm a registered dietitian and have helped over 2000 plus patients. So starting with the webinar, Dr. Soni, can you tell us why the gut health matters or why gut is the door to the body?
Yeah. Thank you, Dhruvi, and welcome everybody. So, when we talk about gut, very traditionally also we say that the gut is second brain. Okay, so it is very traditional way of saying that we have one brain which is up here and another brain which is the gut. So, gut is a door to the body because at the end of every day, what we do to survive is either breathe and then eat food. Right? Eating food is something which ensures that you are living, you are surviving, and your body is functioning. So there is where it is why the gut is the door to your body. The gut ensures that whatever you eat, whatever food you eat, get digested properly in the body, and all the nutrition travels throughout your body. It gives nutrition to the brain, it gives nutrition to all parts of the body so that you function, you live a better life, and you function throughout the day properly. Okay. Also in gut, it happens is like there are many vitamins, there are very micronutrients which is required for our body to day functioning, which gets synthesized in the gut. Okay. So gut is basically the kitchen, the storehouse of our body, and also the excretory part of our body. So the food gets stored, it gets synthesized, all nice things gets absorbed in your body. The body takes it up, utilizes it for the betterment of your body, betterment of your life, and all the bad things which is not required gets exerted, excreted from the body. Okay, so that's why the gut is the door to the body to ensure a better and a healthy life.
Amazing. So basically, to sum it up, gut is the barrier wherein it allows just the good nutrients and good things to be absorbed and keeping the bad out. Thank you, Dr. Soni. Let us understand if IBS is a disease.
Well, IBS is not categorized as disease. Okay, so when we say disease per se, disease is defined when certain cause is attached to a condition. Okay, so like for example, tuberculosis or TB. TB, when we say TB, we know that there is a bacteria, mycobacterium bacteria, which causes the disease. Okay, however, with IBS, it's not something that has certain cause to it. We call it irritable bowel syndrome, as the name suggests. So it is some way irritated bowel. It is a disorder. Okay, so there is like it's a functional disorder wherein a cause is not known. That's why it's not classified as disease. However, it is classified as disorder because people suffer. They have loose stools, they have abdominal pain, they have mood swings, they have bloatings. So people suffer. There's something definitely happening to the body, but it cannot be categorized as disease. So that way, the management of whole IBS differs due to that. Okay, so it's not a disease, it's a disorder. It is a combination of certain kind of symptoms which is presented, and it has to be managed that way. Okay, and interesting part is almost the prevalence of this disease is equivalent to prevalence of diabetes in the country. So 7 to 10% of Indian population right now, with whatever data we have, are diabetic. Okay, similarly, 7 to 10% of people in India are suffering from IBS, which is way below the people suffering in global. Global, it is 25 to 30% of the people are suffering from IBS.
Truly, a lot of people do pass it as a common digestive disorder, but 75% of patients lack a formal diagnosis for IBS. So, if you
Yes.
know anybody who is having any such symptom, make sure they visit the doctor and get them diagnosed. Moving ahead, let's talk about what IBS is, or what are the symptoms and causes.
Yeah. So as I told you earlier, also we say that it is actually an irritated bowel. Okay. When as mood, as a person, when you are irritated, you tend to behave abnormal, right? When you are in not a good mood, you tend to behave abnormal. Similarly, irritable bowel syndrome is a condition wherein your gut is irritated. So when your gut is irritated, it tends to behave abnormal. When it behaves abnormal, it precipitates in form of abdominal pain, there will be bloating, there will be diarrhea, there will be constipation. Okay, so these symptoms, set of symptoms, might vary differently in different people, but yes, they will come together in some form, saying patient will have abdominal pain, bloating, and diarrhea, abdominal pain, constipation, or abdominal pain, bloating. Okay, so it is that kind of irritated bowel which is called irritable bowel syndrome. Now, interesting part is, like, when we are saying again and again that it is an irritated bowel, we would not know why it has caused to you directly. If you go to a doctor and say that I'm having this symptom, doctor will not directly say that do this investigation and we'll get to know. No, it doesn't happen that way, because it is something called a functional disease and not a pathological disease. Okay. No, it's no pathology is involved. Pathology, when I say, it is not that there is no one bacteria or one cause that can be attributed or can be contributed for the condition. However, having said that, there are plethora of other things which is there, which defines us why you or somebody might have that condition. Okay, the most common presentation, as I said, would be in form of abdominal pain or abdominal discomfort. You will feel very uncomfortable, you will feel your abdomen is being heavy. Another thing is, like, you will feel bloated, especially females will be able to relate to it, wherein they will feel that suddenly the dress which were fitting you yesterday or day before yesterday is tight now, especially around the abdominal area. Okay, so that's a very, very common symptom of IBS. And apart from that, there will be something called altered bowel habit. Okay, when I say altered bowel habit, it is like, it might be earlier you were going for washroom or to pass stool once in a day. Suddenly it becomes twice a day or thrice a day. Or earlier you were going once a day, but again it is like, suddenly it will be two after 2 days, or it will become after 3 days. So it's once in 3 days, once in 2 days. So that's a change in bowel habit that would be seen, but most commonly in these kind of cases.
Very well explained about what IBS is. So I see Mohammed Sharik, you've raised your hand. In case if you have any doubt or if you want to say something, please drop it in the chat box. Now moving ahead, uh, IBS and gut microbiome, like you spoke about, that there's no pathological, answer to the entire solution, the entire problem. Now, can you talk a little more about how the disturbances are caused in the gut health because of the gut microbiome?
Yeah. So, what is interesting with our body, Dhruvi, is our gut has a direct connection with brain. Okay, as we call it, like, it has speed dial, phone speed dial with the brain connection. Okay, so the gut has a direct connection with the brain, and gut has an ecosystem of a good bacteria and a bad bacteria. Okay, good bacteria, like, there are good bacteria, like certain bacteria which by synthesis creates serotonin. Serotonin, as we all know, is a mood enhancer, right? It enhances the mood, right? Same thing is with butyrate, same thing with uh, butyrate, and same thing with the GABA. These are all neurotransmitter which is generated by good bacteria, and it modulates the brain. So it is like a DJ system, as I heard it a few days back. I heard it is a DJ system, okay, wherein brain asks for something and gut plays it. So that brain dances in that tune. So that is something the good bacteria. Having said that, why do you need bad bacteria in the body? Bad bacteria is also there. You need it, right? So bad bacteria is a bacteria which trains your body so that if something from outside, the pathological bacteria which comes in your body knows how does the bad bacteria looks in. It is the training system, like the vaccine system in our body. So that's where the well modulated bacterial ecosystem is maintained in the body. When there is some kind of dysbiosis, when you say that good bacteria comes in and bad bacteria increases, then there is a IBS symptom that is precipitated. Also, let's say that sometimes you want to eat, you want to relish street food, अच्छा खासा, you eat golgappe खा लिए, pav bhaji खा लिया, कुछ भी खा लिया, and then you have a bad diarrhea that happened. Okay. So now what happens with diarrhea, since diarrhea is not a normal thing happening, with flushing out of stools, when a good bacteria goes away. So now when good bacteria goes away, there is a bad bacteria in the body that causes dysbiosis. Okay. Having said that, we also are binging people that, okay, we want to take medicines like this. Okay, like antibiotics. Whenever we have two episodes of stool, we say, are kuch to problem again, let me take metronidazole, everything will be taken care of. Okay. So thus that kind of irresponsible medications that we take also causes dysbiosis or bringing in more bad bacteria and killing good bacteria. Okay. Good bacteria relate needs very, very well nourished, very nice, caring environment. So these are the major things that we have seen in IBS patients or IBS symptoms getting precipitated. Okay. Having said that, the trigger for each and every person is different. Okay. What I'm talking right now is the most commonly found triggers. Okay. When we see, let's say, 100 patients of IBS, almost 60% will have some kind of bacterial overgrowth, will have history of some kind of gastroenteritis, or will have a history of some kind of medicines that they might have taken when it was not necessary. Okay. Apart from that, there are reasons like stressors. There can be anything that is happening at home. There can be high FODMAPs. We have food called high FODMAPs, which people will be consuming, which might cause these kind of symptoms.
Right. So truly said, anything good or bad which is beyond the limit could cause issues. And yes, a lot of people do pop medicines like gems where when it comes to self-diagnosis. So I think next time after hearing this, everybody should visit a doctor even for the smallest thing. Now coming to good bacteria, why do we need good bacteria?
Dhruvi,
Yeah.
can we just wait for a minute and take a few questions, or we will take
Yes.
it later? Yeah,
We
because I
can
can
take a
see.
few. We
Yeah.
can take a few now, and later we can take a few of them. I see one of the questions from Mr. Manish. He asked, "What is the difference between IBS and IBD?"
Yeah. So when there's a huge, lots of difference between IBS and IBD. Okay. First is like when we say IBS, it is an irritable bowel syndrome. IBD is inflammatory bowel disease. Okay. So IBS is a functional condition wherein the cause of the disease is not known, and it is basically a combination of certain disorder that is there. However, IBD is an inflammatory bowel disease wherein there are certain lesions found in your large intestine. Okay. Your large intestine will have your large intestine has lots of cells or lots of layers which takes care of digestion. There are different kinds of cells. Inflammatory bowel disease is basically inflammation or those layers of the disease. Okay. So that is seen, we know the cause of that disease. It can be autoimmune, there are infection, and majorly it is autoimmune disease. When your immunity gets affected, you have inflammatory bowel disease. So there is seen, you know the cause of that disease, and there is a certain medication that is required for IBD. So that's where the two diseases are different. The management of two diseases is different. Okay, IBS is treated differently, IBD is treated differently.
All right. So I hope that answers your question. We'll take one more question and then we can move ahead with the presentation. I see Nikita has questioned that how can we know that it is complete or incomplete evacuation?
Yeah, so this is a very subjective perception of complete and incomplete evacuation. Okay, so whenever you feel you are satisfied is the concept of complete evacuation. Okay, frequency is not completely evacuation. It has to be a feeling of satisfaction to say that it is a complete evacuation.
All right. Thank you so much, Dr. Soni. Moving ahead, I would want
Um,
to.
Dhruvi, just one thing, I think it is very relevant. We have a question from Safia saying IBS is a lifelong disorder. Yes, Safia, IBS is a lifelong disorder which needs to be managed. There are various mechanisms where you can have a symptom-free life, but once IBS, it cannot be reversed. It needs to be managed throughout the life. Yes,
Absolutely.
please.
Um, right. So, talking about the good bacteria, why do you think there's a need of good bacteria in our body?
Yeah, so good bacteria are like very sincere and honest personals or office workers that we have in our office. Okay, good bacteria are the bacteria which are responsible to ensure that the food we take are broken properly and all the good components of that food is taken and given to all parts of the body. Okay, having said that, food we eat has gives us lots and lots of micronutrients, macronutrients, micronutrients, various vitamins. So good bacteria is responsible for extracting it from the food, synthesizing it, making it more palatable to the body. That's why the end result is like it helps in digestion. It ensures that your immunity is good. You are able to fight with disease by your own. Your body immune system is good, and also it works as a natural burial system wherein if you have something like any bad pathogens coming to you, your good bacteria is equipped to work with them because they are already trained by the bad bacteria which are present in the body.
Absolutely. So they are the
Yes.
soldiers of our
Yes.
body, basically. So we spoke about the clinical features of IBS. Can you talk a little more about what these are?
Yeah, so as I told you, since there is no proper reason why this disease happens and it is coming with various symptoms which can mimic with any other, like, okay, if you have acute gastroenteritis, also similar kind of symptoms come in. If you have indigestion, also similar kind of symptom come in, right? So to tell somebody is having IBS, we need to have certain criteria put in place and it should come in certain sequences, okay? So when we say about sequences and criteria, the first thing to start is an abdominal pain or abdominal discomfort. A person needs to have the abdominal pain or discomfort for almost three months plus to really say that, okay, person might come into the criteria of IBS. Then it is followed by bloating and altered bowel habit. As I talked to you, it's like altered bowel habit is in form when you are having, it might be constipation to diarrhea or diarrhea to constipation. So that is called altered bowel habit. And having said that, the topping of the cake is stress and anxiety. There is a direct relationship between how your stress level and your anxiety level causes or precipitates the disease.
Right. So generally, we don't pay attention to our bowel habits a lot, but I think it is very important for us to understand about it. Now, let me ask all our participants a question. How is IBS affecting you right now? There could be various reasons. It could be you missed a special function or occasion, or you cannot travel anymore due to constant worry, or you are embarrassed in workplace because of frequent bathroom breaks, because we all know IBS is very unpredictable. So if you can write down your answers, if there's anything apart from this that affects your IBS, please let us know. So, meanwhile, can you just tell us about how gut dysbiosis affects our immune system, or our quality of life, or our focus, attention, time span, etc.?
Okay. Um, I talked about it a little earlier also. So, when I say there is an ecosystem of a good bacteria and bad bacteria in the body, there is a balance way of how good bacteria works and how bad bacteria works. Okay. Due to any reason, let's say there is an infection, there is we indulged in food that was not supposed to, we were supposed to have, like high FODMAPs and all. Good bacteria are very sensitive bacteria. Okay. They are good people, good. So they are very sensitive. They are not very resistant. So they tend to die. They don't tend to be ineffective very, very fast. Okay. So what happens is, like, these good bacteria come in and these bad bacteria kind of flourish in your body. The moment bad bacteria flourish in your body, they tend to bring in lots and lots of the micronutrients, not micronutrients, like the gases, okay, which will cause bloating, which will cause more of discomfort, which will trigger the brain in a way that you are more anxious, you are more irritable, okay. And also there will be micro damages to the intestinal layering, which will cause less of digestion after it is also treated or managed, okay. So that's where bad bacteria plays tandav in the body, wherein everything gets disturbed. Okay, it's like a hurricane that comes in and everything gets disturbed. Like your immune system gets disturbed, your digestion gets disturbed, and your mood gets disturbed. When these things are disturbed, definitely your quality of life will get disturbed, right? When you are not in a good mood, you would not want to attend any meetings in your office, right? When you feel that you have urge to go to toilet every now and then, you will not want to go to travel. You would not want to go or leave house for any other reason, right? So that will also kind of affect your career, your relationship. Like, you don't want to meet people, you don't want to talk to them. So these are the kind of problems that comes in because there is a problem with the gut bacteria or dysbiosis, which has plethora of actions coming over.
Right. So Safia also mentioned that it affects studies. So basically, stress is a trigger for you. I understand that it causes a lot of pressure. Tanuja has also mentioned that it affects the family time and she cannot eat out. So, Mr. Manish, we will be understanding how it affects your gut, and that's how you will be able to manage your IBS a lot better. So let's just understand the science behind it, so you know thoroughly why it is happening, and then we can move on to how to manage it. So now coming to what can be the triggers of an IBS episode. So,
Um, I think we talked about it a lot from the very
right.
beginning. Yes, having said that, food like FODMAPs, stress, and the infection are the major causes of it. And as Manish said, let's get into the solutions.
Okay, so let's just dive in. So, stress and infection have been spoken about, but talking about food, food can be a major trigger because there are certain triggers that can be manageable, certain which cannot be manageable, like season. But when it comes to food, as said, that high FODMAP food can be something which could affect or trigger IBS. So, what are these FODMAP food? They're fermentable oligosaccharides, disaccharides, monosaccharides, and polyol. So, these are certain type of sugars that are present in carbohydrate, which upon consuming you will face certain triggers because they're not well digested in the gut. So what are these FODMAP food, and what food consists them? So certain fruits like apple, pear, papaya, sorry, apple, pear, pomegranate, etc. Certain vegetables like cauliflower, beetroot, etc. Milk and milk products, wheat, suji, onion, garlic, chole, rajma, etc. consist of these high FODMAP food. So I understand that eliminating them could be quite difficult. So there are few easy swaps that you can do in your daily life. So wheat can be easily replaced by either rice, sabudana, or some millets. Maida noodles can be replaced by rice noodles. Beetroot can be replaced by either carrot, capsicum, or any other low FODMAP vegetable. Onions and spring onions, shallot can be replaced by green tops of spring onions. So moving ahead, how to calm your gut. So basically, there would be trigger or a symptom flare up happening, and you don't know why that is happening. So understanding the why and then managing your symptom would be a better way to do it. Now, whenever you had a symptom, so just sip on 2 peppermint tea because it helps in abdominal pain and bloating. It reduces the abdominal pain, so you can switch the normal tea to a peppermint tea. Another could be a cucumber raita. Cucumber and raita both has a cooling effect, so it will help with acidity and gas both. Then lactose-free oats smoothie. Now, oats is very easy on the gut, and also it is rich in fiber, so it will also help in managing constipation. And lastly, curd rice. Curd rice is a sole food whenever there's a trigger, and if you switch to a simple food like curd rice, would definitely help in calming your gut and managing diarrhea both. Now, this is an interesting part of the webinar where we will be showing you 2 images, and you have to select which one is a low FODMAP, and whoever is guessing right, they will be receiving a booklet from us which would have 10 recipes of low FODMAP food or IBS friendly recipes. So drop in your answers in chat box. So let's start. The first is cashew nut versus peanut. Which do you think is low in FODMAP? I'm waiting for the answers. Whoever is gives the correct answer will be receiving a booklet. All right, a lot of people are saying peanut. Manishji is saying peanut. Dhara is saying peanut. Nikita is saying cashew. Nirbhay is saying cashew. Safia says peanut. So let's just come to the correct answer. So peanut is the right answer because cashew nuts are high in galacto-oligosaccharides and polyols. So even a simple or small quantities would cause a trigger. Wherein peanut is something which is a safer option, so you can consume it in about 2 tablespoons or 28 grams of peanut is something that you can enjoy. I see a lot of people have answered the question. Everybody who has answered the right one will be receiving the booklet. Coming to next, papaya or watermelon. Which do you think is low in FODMAP? Vinay says papaya, JS says papaya, Tarun says papaya, Nirbhai ji says watermelon, Safia watermelon. Okay, I think there's a mixed answer to this. So, busting the myth, papaya is low in FODMAP because it consists of an enzyme known as papain, which aids in digestion and helps in reducing the bloating gas. Also, it is a soluble fiber which can help in regulating the bowel, wherein watermelon is high in FODMAP and it has fructose. So even small amount of watermelon could lead to symptom. Thank you for answering on the chat box. Moving ahead, now let's talk about management of IBS. Dr. Soni, can you help us understand how to manage this better?
Yeah. So, as you rightly said, this is a condition which needs to be managed. We have to understand that it cannot be treated. Okay. There is nothing like a magical pill which comes in your condition is treated. Okay. It's something which is there. You are born with it and it will be there with you throughout the life. Yes, it can be managed. The whole idea is to ensure that you have a lesser symptom days. Okay, we are looking into more of a symptom free days when we talk about management of IBS. Having said that, when we talk about managing IBS, how do we begin managing IBS? Okay, so when you already have symptoms of IBS, when you are diagnosed, when you already have symptoms of IBS, we understand that your gut is already a place which has lots and lots of bad things which has already happened. There is a bacterial overgrowth. There is lots of FODMAP which is already there in your body. Okay, it's in your gut. So the whole idea is to first clean that space, right? It's a normal, natural tendency for us. Whenever certain things gets very, very dirty, what do? You kind of declutter it, right? You clean it. There is a cleaning mechanism that happens. As this slide rightly shows that if you want to have fish or you want to have flourish fish in a pond, so you clean the pond first. You bring in fresh water, clean water, and then bring in fresh variety of fishes to ensure that, okay, many other fishes flourish. Similar thing, the metaphor happens with the body, wherein there is a cleansing thing, or you take away all the trigger that is there in your body, you clean it, you kind of manage certain level of dysbiosis, you remove all the FODMAPs from your body before actually giving in back to what is really tolerated by you from IBS point of view. Because it is all about managing, it is not about treatment.
Absolutely true. So I think cleansing of gut is something which is very much required. Now, triggers, to remove the triggers, there has to be cleansing of gut. There will be a calming effect, which would be seen. And you spoke about the quality of life and how the career would be managed if the cleansing of gut takes place. So very truly said about that. Now, what does this gut cleanse do? It actually improves what we have seen with our patients, that it 80% reduces bloating, 75% of people have seen reduction in abdominal pain, 78% people have seen reduction in diarrhea, and 65% people have seen a reduction in constipation after following the gut cleanse. Let me talk about one of the IBS relief stories here. So there's a 40-year-old female who's a homemaker from Hyderabad. She majorly suffered from constipation and complained about bloating, indigestion. And she has IBS for over 15 years, and she's not on any current medication. There's a lot loss of appetite which is observed, and she's been taking only 700 calories a day. So her gut health score was 32 on 100, and it impacted her life significantly. After doing the gut cleanse, she was able to view that a lot of reduction in her symptoms, and she, in the reintroduction phase, she was also able to identify her triggers and the safe portion that she was able to tolerate in. And that led to an increase of gut health score to 75, and it did not affect her, IBS did not affect her life. So that's a great story. There are many more such stories. So talking about the entire gut cleanse program. So what it is a 4 weeks of gut cleanse wherein understanding, or it's the first step to understand what works for you and what does not, to reduce your IBS symptoms. So to know if gut cleanse helps in what kind of food to be eliminated is important. So the phase one is discovery phase, wherein there will be a one nutritionist session. Diet history will be taken, medical history will be taken, because it is a holistic approach and we do not look just as IBS, because nutrition comes first and we need to assess the entire body. We'll be taking care of your food likes and dislikes, geographical preferences, so that diet is not very difficult for you to follow. In phase two of gut cleanse, we give a 4 weeks of gut cleanse, 4 live nutritionist session, 2 live psychologist sessions, 10 yoga training modules, 12 live yoga sessions, and detailed report about the symptom as well. Um, so there's a limited time offer, like Truly said, cleansing the gut is the first step to know what are your triggers. So that is the first step that you have to take today. So there's a limited time offer wherein there's a special discount. You can avail the plan of 3999 at rupees 2000, which also includes 4 live nutritionist sessions, psychologist session, yoga sessions. There are live sessions and a detailed report as well. There's a link that will be mentioned in the chat box. You can just click on that and you can gain back your life. You will be observing a relief in symptoms, be it diarrhea, constipation, gas, bloating. We'll know about what your triggers are and we'll eliminate all those food triggers. You will be able to experience relief and rediscover yourself. And a lot of people did say that they are not able to travel or revisit social occasions. That is something that you'll be seeing. It is an approach backed by science and powered by Dr. Reddy's. So there's just 10 minutes of time. We'll not keep it open for a longer period. There are only 30 seats that are available at rupees 2000. So make your payment and let us know in the chat box. There's a link where you can do the payment and start on today itself. So I think there's 10 minutes of time. Meanwhile, the participants, whoever wants to join us and help us help understand about themselves and how their body functions and what the triggers are, they can make a payment right away. Meanwhile, we can take up few questions. So, all right. Okay, so Padmaji says that ulcerative colitis is similar to IBD. Dr. Soni?
Uh, yes, not exactly similar. When we say inflammatory bowel disease, there are two conditions in that: ulcerative colitis and Crohn disease. So yes, ulcerative colitis is a type of inflammatory bowel disease.
All right. So Manish ji says that he's interested, but he has to drop off. Just drop your number, and what we'll do is one of the team member can connect to you, and we can get in touch, and you can join the program. Moving on to the next question. Um, all right. This is one of the question asked by Mr. Tej. I'm suffering from pelvic floor disorder and IBS problem. So how to manage that?
Uh, See, IBS flow disorder is a well-known program and problem, and that needs to be managed by special speciality which takes care. It involves medical as well as surgical intervention. Okay, so these are two kinds of problem. IBS-C is functional disorder that can be managed through food triggers, food management, and medications. However, pelvic floor disorder is a very specific kind of disease which has to be taken care by surgeons and medical specialists. So these are two different conditions which
All
should
right.
not be clubbed. Yeah.
Okay. So I also see a question from Neha. Some food items that promote good health. So Neha, like I said, there aren't specific food that will help in, managing it altogether. It has to be a lifestyle change. And if you can start your day with the just these simple tips that you can do. You can start your day with a lemon and ginger water, which would aid in digestion, and then start your day. You can avoid keeping long hours of gap between the meals. These are the first two common tips that I would like to give, which will help in promoting a good health and lifestyle. Mr. Vinay Kumar says that can we take pre and probiotic tablet every day? Dr. Soni?
So this is something which is very very controversial in a way that can we take it every day? This has to be coming from the doctor or a medical practitioner, wherein they will need to see the patient and if it is required or not. Okay, when there is a acute nutritional deficiency, when the patient has certain kind of disease conditions, then only a person is prescribed pre and post biotic tablet every day. It should not be taken off the counter and by anybody every time, because as somebody was talking about in the chat, when I'm seeing, there are trillions of microbiomes or microbiota which is there in your body, and everybody's DNA is different. My set of microbiota cannot match your set of microbiota. Having said that, prebiotics and postbiotics are certain set of microbiota which is given in your body. So what it will actually be more bad than good. If let's say you have certain kind of microbiota, you already have lactobacillus enough in your body, and if you start taking it every day, you are actually increasing lots of lactobacillus in your body, which is not good for you. Okay, so yes, the answer is yes and no. Yes, only if your doctor prescribes it. No is when you cannot take it by yourself. The only pre and post probiotic what you can take every day is curd. I think Dhruvi will be able to tell better, which is available at home. Take kanji, take curd, which is a kind of natural source of pre and post probiotic, which will help regulate your body better.
Absolutely. So curd, kefir, these are all natural probiotics which you can take. But considering that will be in the gut cleanse, so starting with a lactose-free curd is better. And then moving on to reintroduction, where we can do a reintroduction for curd and understand if you are able to tolerate that or not. Now here Padma ji has also mentioned about any sessions on ulcerative colitis. So now this falls under the umbrella of IBD, and we'll be talking only about IBS for the webinar. There's a question from Safia. Why do IBS symptoms get worse around periods? Dr. Soni, would you like to take this up?
Yes, during periods, by virtue of various um, hormonal disbalance, we already are in a situation of higher stress and higher peristalsis. Peristalsis meaning the gut, the intestine are already in a hypermotility form. Okay, so they will be hypermotile during or hypermotile. When I'm saying increased motility. So already we are in the high stress and high motility form. Okay, so a person who is already having IBS has that tendency. So periods kind of add to it. That's why you have worsened symptom around periods.
All right, thank you. Meanwhile, let me just remind you that there's only 10 minutes more till we are in the webinar, that the offer is valid. So make your payment right now and you can start the plan as per your, whenever you are comfortable. I see there are a lot of payment already done. I see there are 15 payments which are already done. Welcome to the team. I see Mr. Anurag, Ms. Tanuja has also mentioned that she has already paid for the program. Thank you and welcome. So make sure that you are utilizing this today and you are paying right away so that you can start the journey as soon as possible. Anurag ji has also mentioned about any discount. This plan is already at a discounted rate of 2000. You can definitely make a payment. There's a link which is mentioned. So make sure you click on the link and you make the payment today. Safia has also mentioned that does it affect pregnancy? Can you enhance in this?
Um, I really did not get the question properly, but if I understand, she might be asking, does it affect anybody to get pregnant or not? Is the pregnancy affected? No, there is no effect of anybody being fertile or being able to be pregnant due to their IBS condition.
Great. Anurag ji has also mentioned that everything is disbalanced, sleep, eating menu, timing. Is it possible to rejuvenate and take everything on track? Definitely, I love this enthusiasm that you are here today on a Sunday morning and you want to take health in your own hands. It is absolutely possible. The only thing that you need to do is stay focused and start following the gut cleanse, and you'll be able to understand more about your gut and you'll be able to get everything back on track. Like I said, it will be a holistic approach. There will be lifestyle modifications that will be done. So definitely that would be the entire plan would be helpful for you. And you need to lose 20 kgs of weight. Definitely we'll be helping with that as well. So make sure you go ahead and make the payment. I see Mr. Kiran also mentioning that he has eosinophilic colitis. What is the treatment? Dr. Soni?
See, the treatment cannot really be told like this on the webinar. However, when we say eosinophilic colitis, it is more of an inflammatory colitis that is there. So, if I have to talk generic, it will be more of removing inflammatory food from your diet, which kind of helps in or bring down allergy to your body and thus takes care of the inflammation which is there. And it will soothe the colon. So that would be my take on eosinophilic
Right.
colitis.
So absolutely, if even if you're taking cold water, that could lead to increase in eosinophil count. But when it comes to colitis, removing dairy, soy, wheat, eggs, these are the basic food that has to be eliminated when it comes to eosinophilic colitis. I hope that answers your question. Now, Nirbhay ji is asking, will the timing of the session be flexible or they will be group session like this one? So there are these yoga sessions and that will be there on the app itself, which you will be able to access anytime you want. The nutritionist sessions and the psychologist sessions will be one-on-one, so it will be as per your timing. and the sessions will be absolutely just focusing on you and your gut health. All right, so I think we'll take up few more questions, and there are payments coming through, I believe. All right, a team member is just updating on it. Wow, that's great. There's Manti Das who has also prayed for the program. All right, there are just four more seats available. So I hope everybody in the session is aiming to take the entire, advantage of this today. Moving ahead, is walking after the eating helps in IBS? So Tarun has this question.
Um, Strolling after food helps in overall digestion, okay? But whether it helps IBS is very, very specific. It might not help some people, it might help some people. However, if we look into does it help? Yes, strolling after food, not brisk walking. You should not walk like jogging or having morning walk. Strolling around, light walk around after food helps in digestion.
All right. So we do have a lot of payments coming through, and like I said, there are only four more left. We'll wait for another minute or so for everybody to ask questions and do the payment. The link again is there in the chat box. You can access it from there, or you can drop in your number, and one of our team member could reach out to you. But know that the offer is valid only for today. All right. So I believe we've taken up everybody's time, and it's a Sunday morning. So we can end the session. But if at all, if there's any questions, you can definitely ask. You can drop down in the chat box. You can drop down your number. One of a team member could reach out to you, and we can take the entire program ahead. I see a lot of people have been doing the payment. Thank you for that and welcome aboard. I also mentioned about the WhatsApp community. I hope all of you have joined that. Thank you, Dr. Soni, for coming in today and explaining about the entire IBS and how does that works. And I hope all your questions are also answered today. Thank you, everybody, for joining. Thank you so much.
Thank you so much. Thank you, Dhruvi.